Do you follow the carnivore diet? The carnivore diet is a form of the keto diet. You've probably heard of that, but it's sort of more, not sort of, it definitely is more restrictive than sort of the general keto diet that we think of, okay? Carnivore diet, this is according to Harvard Health. What you can eat on it is meat, poultry, eggs, seafood, fish, some dairy, and water. And I'm sure that some sources have a little bit of a change in that. I mean, I'm sure depending on whose carnivore diet you follow, there may be a little bit of tweak to that, but that is according to Harvard Health. What you cannot eat on this diet is there's no veggies, no vegetables at all. There is no fruit at all. There are no grains, no legumes, beans, things like that, no seeds, no nuts, okay? None of that. As you can see, it's very restrictive. Keto is minimal carbs in general, okay? With the keto diet, you are allowed some carbs, like the traditional keto diet that we think of. This is the carnivore diet. It is a form of keto because there are no carbs. But in this diet, there's like zero carbs, like zero, which I think is pretty remarkable. I have problems with this diet, as you can probably tell. I'm going to tell you 9 potential dangers of this diet. I want to know if you try this, if you use this, what have you. And let me just also say that a lot of people say that this diet does a lot of things for them, whether it's fixing acne, giving them energy, or what have you. And then, of course, when you get to keto diets, like this idea of, sort of having fewer carbs, what happens when you don't eat a lot of carbs is your body basically starts burning fat, okay? And that's how ketones are developed, but also with that comes weight loss. A keto type of a diet will very likely cause you to lose weight. That is a fact. It's actually how the science works. I should also say that traditional keto diets have been used in certain medical conditions as treatments too. So I'm not knocking keto as a concept, but carnivore, remember, is a keto type, but it's more extreme. There's like zero carbs. I know I keep saying that, but okay. So let's get into some of the potential dangers of this carnivore diet, okay? Number one, when you're eating that much meat, the likelihood, I'm guessing, is that some of that meat may not be the healthiest. And with a lot of meat comes a higher diet in saturated fats. What do saturated fats do? They increase our bad cholesterol, the LDL cholesterol. What does that mean? That means a potential increased risk of heart disease and all sorts of high, obviously that high LDL often translates to high cholesterol, but higher risk of heart disease, et cetera, and some of those risks that come along with it, okay? So that is a major concern is my patients, if they were trying this, getting an increase in saturated fat, which is not what we want. Also, according to Harvard Health, the carnivore diet can increase your risk for kidney stones, gout, even osteoporosis, and very likely there are probably other things that can be, other risks of conditions with this. The other thing, too, I should say, and kind of along those lines, is when you're taking in a ton of protein, and I've seen this before in my practice. I did have a patient that was overdoing it on protein. This was years and years and years ago, and he really kind of shot out his kidneys for a while. Okay, if you're taking in too much protein, it can actually potentially damage your kidneys. Now, of course, it depends on what people are choosing to eat on this carnivore diet. But remember, what I mentioned is really all you can eat in the strictest form is what I say: meat, poultry, eggs, seafood, fish, some dairy, water. So obviously, this would be the people who choose to be on sort of the more red meat heavy sort of spectrum, or the protein heavy spectrum with those two particular issues. The fourth thing is, yes, we are on number 4. Restrictive diets are just hard to follow. I mean, let's call a spade a spade. Diets in general tend to be hard to follow, okay? Imagine not just trying to stick to your regular diet, which just might be like, oh, hey, let's not eat cupcakes this week. But stick to a diet that really has no carbs at all. That means fruits and veggies and nuts and seeds and stuff like that. Grains, right? Those are usually major parts of our diet. It's hard to stick to. It's hard to keep up. I remember years ago, I tried like the regular keto diet. I was trying to lose some weight, and I said, okay, let me try keto. And with keto, that's sort of the classic kind, you can have some sugar, some carbs. I couldn't stick to it past like a day and a half. I just couldn't. It was way too restrictive for me. The other thing is that there's a lot of people who just actually feel fuzzy in the head when they go on, number one, restrictive diets in general, but something like this, where, you're not taking in any carbs, you could really get kind of fuzzy in the head, not feeling yourself, not feeling right. And that's a big thing. These other things, okay, this is really important. The next one, Remember, you're not taking in grains and stuff like that. You're not getting a lot of fiber with a diet like this. And what does that mean if you're not getting fiber? It means you could be constipated. Your bowels could really be kind of jacked up. And remember, fiber is not just good for constipation and bowel health, it's actually good for a lot of other things, okay? Fiber tends to be very important, so don't underestimate the potential side effects that could happen, and that's what I want to let you know. I know that many of you watching this video may be writing in the comments right now, she doesn't know what she's talking about, carnivore is the best diet in the world, and I hear you, and I'm here to listen if that's how you feel. I hear you. But I also just want to say, I always say like everything in moderation. And the reason why I say that includes diets is because there tend to be sometimes more side effects when we're not doing everything in moderation. And look, no fiber in your diet, you're going to feel that. All right. Moving on to the last few. Remember that this no fiber thing, no fruits, no veggies, no nuts and seeds. What are we missing out on here? We're missing out on a ton of nutrients, not just fiber, but antioxidants. We're missing out on vitamins. We're missing out on minerals. We're missing out on things that our body actually needs to function well. And what's interesting to me is that, I literally almost every other patient is asking me, well, what vitamins and nutrients do I need? Because oftentimes we think we need them, but then there's this other side where, if you're interested in the carnivore diet or other extreme diets, you could actually be, utilizing a diet that inhibits your ability to get nutrients. And this one, in my opinion, certainly would do that. The second to last thing I want to mention is sodium content, right? There's some sodium in some of these things, okay? And depending on what you're choosing to eat, again, a lot of this is going to depend on what the person chooses to eat, but there could be a high sodium content in what you're choosing. That, in addition, could increase your risk for high blood pressure and other sort of heart disease related types of conditions, which we don't want. And then the last one, last potential danger, which may come as a little bit of a surprise, you may not have expected it, but I do want to mention it, is we know that sort of the environment is impacted by meat production, or sort of, meat production, okay? We know that, and look this up. I'm not an environmentalist and I'm not a policy person or whatever, but I know enough to know that, increased meat production may increase greenhouse gas emissions and do so many other things, potentially negatively impacting, and not potentially, negatively impacting our environment. That's something to kind of keep in mind. Not something to kind of keep in mind, it's something to definitely keep in mind. There are likely other risks. I'm sure there are. I just have not mentioned them all, but these are some 9 at least that I want you to think about, okay? Again, I always believe everything in moderation. I believe if you want to try the carnivore diet, you really should talk to your doctor first, because there are certain people that, I might say if they wanted to try this, I might be like, well, these are the risks, I don't recommend it, but for someone like you, if you wanted to try it, I could also see myself with other patients being like, hey, I'd like to try this diet. I'd be like, absolutely no, never, because of their underlying conditions. So my thing is, if this is something you want to try, just do your due diligence. And that doesn't mean read different blogs and different podcasts and watch podcasts. That means talk to your doctor about it, okay? Let me know in the comments what you do. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos. Let me know what you think. I know you are. Subscribe to my channel on YouTube. Please like my page on Facebook. I'm also on TikTok and WhatsApp and LinkedIn and Instagram and Threads and all the things. Let me know again. I have other videos about other diets. I'm going to link them here. Water fasting, the fruitarian diet, and so many other diets people have tried and do try, and give you my thoughts on that. Also, go to my website, drjencaudle.com, to sign up for my free weekly health newsletter. Guys, I'm Dr. Jen.